Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Hi there and welcome. My name is Dr. Marlena Jabara, and we'll be talking about Rearfoot Varus. On these x-rays, we can see at the lateral x-ray, we have an exaggeration of the plantar arch with some horizontal rotation of the talus and elevation of the talo-first metatarsal axis. In addition, we have medial peritalar rotation, which we'll talk more about. As the talus moves medially, we can see that the vector forces are more on the lateral side of the foot, and this contributes to this hindfoot supination biomechanic. The hindfoot alignment view in the standing position can be seen that the talus is varus relative to the tibia. Moving on to the phases of walking, we recognize two different phases during the gait cycle: the stance phase and the swing phase. The stance, or the support phase, we spend about 60% of our time, and it starts at an initial heel strike. It moves to early flat foot, then late flat foot, moving us forward in the tibia, and then toeing off, and of course the swing phase. Swing phase or recovery is about 40% of our time, and it represents that time from toe off to heel strike. The foot can serve as a shock absorber at the heel strike and adapts to uneven surfaces. At push off or toe off, the foot is a rigid lever to provide a propulsive force forward. Initial heel strikes in runners occur on the lateral aspect of the foot with the subtalar joint in supination. Looking at gait, the shape of the arch will vary during the different events of the gait cycle. The Chopard joint is going to alternate between locking and unlocking during the walking process. So at the end of the stance phase, the heel is everting, and the calcaneocuboid and talonavicular joints are no longer parallel, and they lock, becoming immobile to stabilize the foot. At the heel strike and the mid-stance phase, the heel is inverting, and thus the two joints are parallel and unlock. That allows for the motion across Chopard's joint to allow us to get from that heel strike to toe off and have a relatively flexible foot. A great amount of stress placed on the great toe, the first ray, with associated muscles and ligaments like the peroneal tendons playing an important role in maintaining that stability and flexibility of the arch with all our body weight on that toe-off portion. Hypermobility of the first ray can occur during activities that can lead to pes planus or hallux valgus. The first ray does maintain flexibility at the beginning of a pes cavus foot, but with persistent plantar flexion, this may progress into disease. One important question that's asked when we see Rearfoot Varus is it compensated or uncompensated? And by uncompensated, they want to understand whether or not the person is able to get the tripod, their Cotton's triangle, on the ground, which exists between the heel, the base of the fifth, and the base of the first. So we have the heel, the first, and the fifth that keep us on the ground. And if in the neutral position they can get the first ray to the ground, this condition is said to be compensated. If they can't get it all the way down, but they can get it to the ground, it's partially compensated, and it follows. If they can't do that at all, it's uncompensated. And what's common is that in a Rearfoot Varus deformity, particularly those are uncompensated, they're going to be accompanied by limited amounts of calcaneal eversion. The calcaneocuboid joint not going to be able to get the first ray all the way down to the ground, and it's going to present clinically with exaggerated sprains and strains. In general, there's normally about 4 degrees of calcaneal inversion occurring in a normal foot, but patients who have rigid Rearfoot Varus don't even have the ability to get that to 0, and there's a large momentum going on to the great toe. When we think about the biomechanics of pes cavus, cavus foot is defined as a foot with a high medial arch, and that has an estimated prevalence of about 10% of adults. The components of biomechanics of pes cavus will be looking at abnormal elevation of the medial arch, varus hindfoot, a high calcaneal pitch, a high-pitched midfoot, plantar flexion, claw toes, and metatarsus adductus. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.